About 50 million people worldwide with dementia will be interested to hear about what came out of a big conference in L.A. that's just concluded. Experts and scientists shared the latest findings on research in the field. Now, one of them is here to share them with you, the medical director of the Toronto Memory Program, Dr. Sharon Cohen.
It was a fantastic meeting of over 6,000 people from 70 countries. Started off with a little bit of a gloomy mood because some promising drugs have recently failed. But as the conference progressed, the understanding that there are more and more things coming, both in the way of early diagnosis and potential exciting treatments, really overtook the conference. I think it was a very successful meeting.
You were talking about early diagnosis. Anything new in that area?
Yes, there's a lot new. We know that we miss about 50% of people with Alzheimer's. That's how shocking the numbers are, that we underdiagnose by about 50%. And of those that we are sure, even in expert hands, have Alzheimer's disease, we're wrong about 30% of the time. That's astounding. And how is that going to work once we have, and we will eventually have, a definitive treatment? How are we going to identify the people who can benefit? So we have, in the last few years, had fancy things like PET amyloid scans with tracers that can pick up very early on proteins that change in Alzheimer's, and we can do the same thing with the spinal tap. But we are going to need some really accessible, less expensive methodology. And now things are being detected in the blood that are equivalent with the same accuracy as in the spinal fluid or on PET scans. And there will be a blood test for Alzheimer's disease within the next year or so, not just to diagnose, but also other blood tests coming that can tell us more about, are you a fast progressor in this disease, or do you have lots of time? Are you somebody who's got 20 years with this disease rather than, being over and done with and needing long-term care within 5 years? So things that can track progress of disease and hopefully monitor response to treatment the way we have in cancer medicine. And in the cases we think have Alzheimer's disease and we're wrong, there are other diseases of the brain that can mimic Alzheimer's, and without being able to detect with a blood test or a special scan that this is in fact not Alzheimer's, people get mislabeled.
And that's why with the blood tests, which can confirm it, and you're saying in about a year or so, you think blood tests will be more mainstream?
Yes, and this will be a huge advance because not everybody in the world who's struggling with, is my forgetfulness Alzheimer's or am I at risk, is going to have access to a PET scan. It's expensive, and even if you had the money, you can't always access a PET scan. They're in specialized centers. So this would be a huge advance in the field, early detection.
The conference that you were at out in L.A. also heard about clues as to why women may be more likely to develop Alzheimer's?
Yes, we're trying to piece that together. We know that women live longer, and we used to say, well, it's an age-related disease. Women live longer. That accounts for why we see more women. But now there's more research into hormonal factors and other factors in the brain that might allow the spread of these toxic proteins to move faster, actually, in women compared with men. So it's not entirely worked out, but there seems to be more than just the age factor.
Dr. Cohen, what about the immune system and the role it plays in maybe one day coming up with a cure?
This is fascinating. We've known that in association with plaques in the brain from Alzheimer's, there are inflammatory cells. And we thought that's just a byproduct of the disease. Now we know that the innate immune system in the brain plays a very active role in driving the disease. And it might be that amyloid is the first protein that accumulates, but then you get a whole host of immune reactions that either work well or don't to determine whether we're going to progress further. So the immune system is responsible for getting rid of junk in the brain, including amyloid. That has to work well. But the immune system, when it's overactive, can generate its own toxic substances that can make brain cells die more rapidly. So now we understand this better. Not only do we understand the biology, but we are developing drugs in the treatment pipeline that will tackle and either suppress or rev up the immune system, depending what aspect we're targeting. And hopefully these will be a new generation. So not just looking now at tackling amyloid or tau, but the actual immune system that may be very, very important in generating the disease to begin with.
That was Dr. Sharon Cohen, Medical Director of the Toronto Memory Program. I'm Bob Komsic in for Libby Znaimer, and this is the Zoomer Week in Review. Coming up, your